I'll tell you something about stomach cancer, otherwise called gastric cancer, which is very common in southern India. And if a patient who has got sudden loss of appetite and who's been eating 4 idlis, 5 idlis and 3-4 doses is able to eat just one idli or half an idli, all of a sudden, there's a possibility that patient has got some stomach cancer. One has to suspect, especially patients who are middle-aged and above. And when this happens, when you clinically examine, sometimes you'll be able to palpate some mass-like thing in the abdomen. And the best way to diagnose this condition is by endoscopy. You put a tube through the mouth and go into the stomach and see an ulcer which doesn't look good, and we have to take a bit of the mass in the stomach for biopsy, and once biopsy is confirmed, then the treatment protocol starts. Before treating these patients, we have to make sure that the cancer is not spread anywhere, it is only in the stomach. This is by doing a CT scan. One can make out whether there is some water in the stomach, or the tumor is spread to the liver, or it is spread to the food pipe. It's called gastroesophageal junction cancer. And actually the cause for this cancer is is understood as by eating pickled foods, especially salted fish, and has been kept in the sun or stored for many months and then cooked and eaten. Anything which is pickled, there's a possibility of. Actually, gastric cancer is very common in Japan, Korea, Taiwan for some reason. Now they've very routinely screened patient by endoscopy at a certain age to make sure that they'll catch any gastric cancer very early and treat it, because if this cancer is diagnosed early, it's possible to cure it completely, but if it's slightly delayed, then the treatment results are not that good. Treatment is always surgery. There is no medical treatment for gastric cancer. What exactly you do? You cut and remove that part of the stomach where the cancer is there. Sometimes the stomach is quite a big organ. If the cancer is towards the end of the stomach, that part alone is removed. If it's to the beginning of the stomach, then there is no choice but to remove the entire stomach. It's called total gastrectomy. This is done by open surgery, is done by laparoscopic surgery, and these days we do this also by robotic surgery. Robotic surgery, laparoscopic surgery, you have better comfort for the patient, because since the openings are small, the recovery is very quick. And you often wonder, once the stomach is removed completely, how will the patient eat and how will he digest? For that, what we do, we make use of small intestine and substitute it for stomach and stitch it to the food pipe. So patient will be able to eat very less, but he can definitely eat and maintain his health. He may lose weight, but he will survive. So once the gastric cancer is operated, and after that the specimen is taken for complete biopsy, based on the biopsy report, we will know what is the stage of the disease, whether they will require any treatment after surgery in form of chemotherapy, radiotherapy and so on. And these gastric cancers come between the rectal cancer and liver cancer. They have a somewhat better survival than liver and pancreas cancer, but they are not as good as colon cancer. So gastric cancer is a common thing in southern India. If anybody is suddenly losing weight and losing appetite, that this has to be checked by endoscopy and seeing a specialist, and if diagnosed, confirmed by biopsy, one has to undergo surgery and the removal of the part of the stomach where the cancer is there, and followed by chemotherapy for long survival. Thank you.